Institute, the researchers were aware that the experiments were illegal. We've always insisted on maintaining confidentiality, even at the cost of thereby becoming immoral at best and criminal at worst, said Gebhardt. An example of criminality is our refusal to cooperate with authorities in apprehending a pedophile we had interviewed who is being sought for a sex murder.
Kinsey would have done business with the devil if it helped the research, and this is true. The research was absolutely paramount. And he was astute enough to stay out of trouble. He got in practically no trouble, but he worked at it.
Related to that, of course, is the question is, did parents give consent to what was being done? And nobody has indicated to us that consent was given. Indeed, these co-workers seem to indicate to us that consent was not given, and they didn't really see it as terribly important because this wasn't going to be particularly harmful to the children anyway.
There is another possibility regarding Kinsey's data on children, that the experiments never took place.
We have the other serious implication that the data are being used as if they were real in order to generate a whole view of child sexuality and availability of children in sexual encounters, which is based on nothing.
If that is so, then scientific fraud may have occurred. In either case, the reliance on reports of sexual torture of children under the auspices of federally supported research cries out for examination, especially since Kinsey's research had such a profound effect on the entire sex research field.
I went back to get a degree and went into the human sexuality program at New York University. And it was when I was in that program that I began to learn and see the indoctrination of what has been called the Kinsey Grand Scheme. Now that term comes from Wardell Pomeroy, Kinsey's closest associate, but I experienced it firsthand in an international health seminar held in Holland, organized by my professor, Dr. Derek Calderwood. Calderwood initiated nude body workshops in which he would give quasi-medical excuses for men to touch each other's genitals and for women to interact in different feely-touchy situations.
The Kinsey Institute has dominated the world of sexology through the migration of Kinsey disciples to several key centers of sexology, including New York University, the University of Pennsylvania, and the Institute for the Advanced Study of Human Sexuality in San Francisco. These three institutions account for the lion's share of the academic credentialing of sex educators in the United States. Working with the Kinsey team was Dr. Mary Calderon, who was medical director of the Planned Parenthood Federation of America from 1953 to 1964, before co-founding the Sex Information and Education Council of the United States, better known as SIECUS.
She formed that organization with Lester Kirkendall, another pioneering sexologist who was the teacher and the mentor of Derek Calderwood, my professor.
Also involved was Kinsey's co-author, Wardell Pomeroy, a founding member who also served as president of SIECUS as recently as 1975.
In terms of Lester Kirkendall, in 1985, he made a statement in an article entitled Sex Education in the Future that I think is worth noting. He says that programs of the future will probe sexual expression with same-sex partners, and even across generational lines. With a diminished sense of guilt, these patterns will become legitimate, and the emphasis on normality and abnormality will be much diminished with these future trends.
The most obvious impact of this effort is to demystify the taboos of sexuality in sex education classes to very young children. Many sex education curricula now begin in kindergarten and continue through high school, often under AIDS prevention. The message to parents, if we don't begin teaching children about safe sex as early as possible, including every variation, then they may get AIDS.
Mrs. Smith or Ms. Smith from from somewhere in Ohio, who goes for her 3-unit training in human sexuality because she has to teach human sexuality to the kids, and she has to teach AIDS prevention. She goes to an accredited sex educator, and she will be trained in the Kinsey model. That is the only model that she can be trained in. And as a result, then, she has to set aside whatever value structure, whatever moral structure she's been carrying all these years, because she's been told that the science has proven that children are sexual from birth, that children have orgasmic potential from birth, that this, therefore, can be perfectly fine.
How can you be protected from AIDS, like when you're having sex?
Well, one of the best ways, Magic, is wear a condom, isn't it?
Yes, it's the safest way is to wear a condom.
As a result, some schools and even a documentary presented by Nickelodeon are instructing children as young as 8 years old in how to use a condom.
You roll it down the penis, and that protects the man when his penis is inside the woman's vagina.
Children are also told how to perform anal sex. At a Safe Sex Youth Conference in New York in 1994, children as young as 12 were given graphic brochures advising boys to enjoy safe sex with men and encouraging girls to experiment with lesbian sex practices that could cause sterility.
Nowhere in the program curriculum that was developed to be the guidelines for future sex education was there anything that suggested sexual behavior, any form of sexual activity such that might be categorized or abnormality.
The Kinsey view of child sexuality has also been promulgated by Dr. John Money, perhaps the most prominent sex researcher in America. A founding board member of SICAS, Dr. Money has written numerous books as well as hundreds of papers, reviews, and textbook chapters on the subject of sex. In 1990, Dr. June Reinisch dedicated her book, The Kinsey Institute New Report on Sex, to Dr. Money, whom she describes as one of my mentors. Recently, Dr. Money was interviewed by Pidika, the journal of pedophilia, which is published in the Netherlands. The journal argues for man-boy sex and contains advertisements for the North American Man-Boy Love Association and other pro-pedophile groups. Kinsey Institute associate Dr. Vern Bulow is on Pidika's editorial board, which issued this statement of purpose. The starting point of Pidika is necessarily our consciousness of ourselves as pedophiles.
But when you look at the journal Pidika, the Dutch journal, you will see that on the board of directors you have people like Vern Bulow. Vern Bulow was the president of the Society for the Scientific Study of Sex when they formed the accrediting committee for future university programs that give degrees to sex educators. Vern Bulow did the foreword for Edward Brongersma's 2 volumes, Loving Boys. John Money of Johns Hopkins Hospital and the mentor of June Reinisch was interviewed in Pidika. And of course, he's one of the people saying that sex with children can be an enriching experience and doesn't harm the child.
In Dr. Money's interview in Pidika, he was asked about child sexuality. His reply, "If I were to see the case of a boy aged 10 or 12 who's intensely attracted toward a man in his 20s or 30s, if the relationship is totally mutual and the bonding is genuinely totally mutual, then I would not call it pathological in any way." This attitude mirrors that of Dr. Kinsey, who once wrote that it is difficult to understand why a child, except for its cultural conditioning, should be disturbed at having its genitalia touched.
In 1965, the Kinsey team published the book Sex Offenders, which argued that sexual behavior was so varied that certain activities should not be singled out for harsh punishment. During the past 10 years, reports of child abuse cases have soared to more than 2.5 million annually. Although many of these cases have proved to be false reports, it is clear that child abuse and the perception of child abuse is a growing problem. Increasingly, child abuse experts are expressing concern about Kinsey's impact on the way people view sexuality.
One of the objectives of Kinsey-type programming is to change the concept of the family. And if you think about it, if Heather has two mommies and Daddy has a male roommate, in a way, you're denormalizing the heterosexual nuclear family. And if you remember from the pedophile-type statements in the writings, for example, of Theo Sanford, he said that if children could be weaned away from the nuclear family, they could then form emotional attachments with others beyond the family. So, in a sense, the systematic destruction of the concept of a family with a mother and father, and with the family breakups and divorces that are occurring, it's a very opportune time.
Attempts to uncover evidence regarding the experiments on children had been rebuffed by the Kinsey Institute. Former director Dr. June Reinisch, interim director Dr. Stephanie Sanders, and other Kinsey personnel either declined or did not respond to interview requests. Dr. Money also declined to be interviewed. Child Magazine featured an article by Dr. Reinisch urging parents to regard their children as sexually active and to promote more sexual activity.
Given its critical role in overhauling a culture that used to value and protect children above all else, the Kinsey report is long overdue for scientific scrutiny.
He used data from the rape of children, as we've discussed, some as young as 2 months, to demonstrate and prove childhood sexual capacity. He concealed the full nature of these experiments, and he concealed information on who performed these experiments. He extrapolated these data to describe normal childhood development. He did not follow up these abused children as was ethically and morally required, though the identities of many of these children are known and known today, and they still could be followed up and should be. Furthermore, he shielded criminals who were involved in this work, including one murderer that we know of, from the police. If I have not said enough about the need for this research to be investigated, then I doubt if there's really anything else that could be said.
These questions need to be answered. How were the children procured for the experiments recorded in Table 34? Where are they now? Most would be in their 50s. Also, many of the Kinsey associates themselves are still around, but most of them are elderly. It's important that they be given the opportunity to shed light on what happened before it's too late, before any more children are victimized.
One of our big problems, of course, is the way in which the Kinsey model of sexual education has gone from the university level, that is being taught at the university level through the Kinsey people, for teachers and so forth, from the university to the college, from the college to the junior college, from the junior college then to the high school. As our teachers have become trained, quote unquote, in the field of human sexuality, they then train those below them who train those below them. That then filtered out. So we began in 1953, really. 1948 was Kinsey's book on men. 1953, women. We began to train people at that university level with all of this false data, all the fraudulent data. That then filters down to to high school, to junior high school, and now we've got this thing spreading out so that we have teachers and we have parents in an uproar all over the United States of America, being forced indeed to teach things that we are arguing are fundamentally fraudulent. And fraudulent means that you'll get bad results. You get bad results when you have bad data.